Hello, I'm Andrew Saul, and this is the Vitamin Masterclass.
Why should you watch it? Because it can save your life. Not an overstatement. Medical doctors have been using high doses of vitamins to cure serious disease for 75 or even 80 years. Your doctor perhaps doesn't know that, but it's important that you do, all the more so. Back in the 1930s, Klaus Jungblut at Columbia University showed that vitamin C could reverse polio, and if given to patients with polio, they did not get paralysis. In the 1940s, Dr. William Kaufman was treating osteo and rheumatoid arthritis with high doses of niacin or niacinamide, vitamin B3. He had people whose arthritis was so bad they couldn't even bend their elbow, and they were able to do that and more within a matter of a week or two. During the 1950s, Doctors Wilford and Evan Shute were curing cardiovascular disease with high doses of vitamin E. They treated over 30,000 patients. Dr. Frederick Robert Klenner, a board-certified chest physician, was treating successfully viral pneumonia and curing it in 72 hours with high doses of vitamin C. And then into the 60s, the 70s, the 80s, and the 90s, we find that vitamin C is selectively toxic to cancer cells. This is the kind of information that you need to know because it is so very, very important. There isn't any question anymore. Vitamin therapy is not alternative medicine. Drugs are the alternative. What should be done is using vitamins from the start. That's why you want to tune in. It's going to be a great journey.
Let's begin that journey right now. Orthomolecular medicine is nutritional medicine. Generally, it uses fairly high doses of nutrients, which makes it different from conventional food groups dietetics. It's also about curing disease, not just helping people eat a little bit better. Big difference between dietetics and orthomolecular medicine. Linus Pauling said that orthomolecular medicine was, quote, varying the concentrations in the human body of substances that are normally present in the body and are required for health, unquote. Linus Pauling gave this branch of medicine its name. Orthomolecular means the right molecule. So you're taking substances that your body knows and has used to be healthy over millions of years of evolution, and it increases the amount of those nutrients in order to more effectively prevent and especially reverse illness. So using more of substances that are natural to your body is a common sense way to approach healing. Pauling, the only person in history to have won 2 unshared Nobel Prizes, is generally regarded as a very reliable scientist, a very reliable man. And he gave orthomolecular medicine its popular recognition. Not by the name orthomolecular, perhaps, but just the idea of using high doses of vitamins. And Dr. Abram Hoffer, my mentor, a friend of Dr. Pauling's, is probably the one responsible for an even more popular moniker, which is megavitamin therapy. It all means pretty much the same thing. No matter how you look at it, orthomolecular medicine, nutritional medicine, is the basis of health. Plants make their own food. The entire plant kingdom is orthomolecular, unless perhaps Monsanto Bear gets in there. But outside of that, outside of the GMOs, the whole world is orthomolecular. Animals eat fresh, unprocessed food. The entire animal kingdom is orthomolecular. Remarkably, all these animals have evolved over so many eons, and usually animals in nature will never even see a veterinarian. Long before vitamin supplements were available, it was food that provided the right molecules for healing. Indeed, vitamin supplements have only been widely available for the last 50 or 60 years, and vitamins have only been discovered in about the last 100 years. So this is new, having actual concentrated vitamin supplements so we can get higher doses. And this is the key. It's about dose, dose, and dose, said Dr. Thomas Levy, a medical doctor, cardiologist, and attorney, and friend of mine. Let's take a look at credibility. Let's see, Linus Pauling won 2 Nobel Prizes, Thomas E. Levy, board-certified cardiologist and physician and attorney, and another good example today of a physician that has impeccable credentials who advocates high doses of nutrients to cure disease would be Dr. Suzanne Humphries. Dr. Humphries, a medical doctor, is also board-certified in internal medicine, and she is a board-certified nephrologist. She uses extremely high doses of vitamin C to cure illness. There are many others, and we are going to talk now about Dr. Klaus Washington Jungblut. Dr. Jungblut, born in 1898, is certainly one of the originators of what we would now consider the orthomolecular approach. He was a polio researcher. Now, in terms of credentials, he was an MD, and he taught at Columbia University. He was a full professor of bacteriology. Once again, this is an impeccable credential. And he used vitamin C to prevent and treat polio. And he published on this idea in 1935. Now, ironically, in 1935, the United States had a president, Franklin Delano Roosevelt, in office who had, in fact, been partially paralyzed by polio. So when Jungblut is talking about using vitamin C to prevent and cure polio, the nation has a president that actually had it, and Jungblut's work was not entirely ignored. He published other papers on polio in 1937 and 1939, a series of at least 5, all in the Journal of Experimental Medicine. People were looking at this, and they were thinking about it. Indeed, in 1939, the September 18th issue of Time magazine reported that Jungblut said that low vitamin C status was associated with polio. What happened? What happened? In 1939, we were actually thinking about it, and by 1969, anybody who said that vitamin C could stop polio would be laughed right out of the room. Jungblut used very low doses and still saw that vitamin C was an antiviral and also an antitoxin, and said that. Jungblut actually stated, quote, vitamin C can truthfully be designated as the antitoxic and antiviral vitamin, unquote. This is a medical doctor and professor of bacteriology at an Ivy League university. Then Jungblut showed that vitamin C inactivated diphtheria toxin and that vitamin C inactivated tetanus toxin. All this before Hitler invaded Poland. All of this in the mid and late 30s. We have another physician, Dr. William J. McCormick, born 1880, truly a pioneer. He practiced in Toronto, Canada, and he developed this idea and used higher doses. He would give injections of gram-sized doses, that is 1,000 milligrams or more, of vitamin C, whereas Jungblut used far less. McCormick saw that vitamin C deficiency was the essential cause of many illnesses, and he was one of the very first to report on this in the medical literature. As early as 1947, he was showing that disease in general is related to poor diet and especially a lack of vitamin C. McCormick also showed that vitamin C not only does not cause kidney stones, it actually helps prevent them. And he published on this the year before that, in 1946. McCormick noted that coronary heart disease is related to vitamin C deficiency. Specifically, he found that stroke is caused by a bleeding, a weakness, in a blood vessel. Blood then can get into the blood vessel, and of course there's already blood in a blood vessel, so you wonder, wait a minute, how's that happening? How can a blood vessel bleed? Well, the blood vessel is a tube, like a hose, and it carries your blood like water through a garden hose. But the hose itself is not plastic, it's alive. So your blood vessels are alive, and they are fed themselves by smaller blood vessels. Remember, everything in you is made out of cells. And if the cells are not held together by strong collagen, and you need vitamin C to make collagen, you then have the possibility of leakage. You have a possibility of breakage, a rupture, a lesion in the blood vessel. And when that happens, the blood vessel will actually bleed into itself. Now, the body doesn't want that, so what happens when you cut yourself? You form a blood clot, and that stops the bleeding. You have a scab on your skin, no big deal. Scab dries, falls off, everything's fine. But in the blood vessel, it's different. If you have a blood vessel that has leaked and clotted inside itself, and that's where it's going to happen, when that clot forms, that can break off and then go to the brain and cause a cerebral vascular accident or a stroke. And indeed, this is why cigarette smoking is so dangerous. Now, all of this was brought forward by McCormick way back in the 40s and 50s. McCormick was pretty much the first physician to speak out against the dangers of cigarette smoking. He found in his own research that each cigarette neutralizes approximately 25 milligrams of vitamin C in the body. And he published on this in 1954. And McCormick believed that it was this deficiency of vitamin C that caused the weakening in the walls of the blood vessels, which then would break, bleed into themselves, clot. The clot would break loose and transport to the brain, and there's the stroke. So he saw that cigarette smoking caused heart disease. The same is true with other forms of heart disease. McCormick linked them all in. Not only that, but in 1954, McCormick published that persons with cancer almost always have exceptionally low levels of vitamin C in their bodies. And it takes, he said, about 4,500 milligrams of vitamin C just to bring them up to a normal level. Now, if the RDA is under 100 milligrams, and a cancer patient is in the minus column to the tune of 4,500, we have a scorbutic situation which favors cancer. And by taking massive amounts of vitamin C, we are simply correcting something that the disease has done to us, or that smoking has done, or smoking caused the disease. You can now see the connection. If smoking robs you of C, and a lack of C is associated with higher cancer rates, then we can see the cigarettes can cause cancer as well as heart disease. And they do. 1954, McCormick publishes on this. Isn't that just amazing? Today, the RDA for smokers is 125 milligrams a day. Only 115 milligrams for you, ladies. And yet McCormick showed that those with cancer have a 4,500 milligram deficiency just to begin with. Now McCormick and Jungblut, Dr. Levy, Dr. Pauling, Dr. Humphreys, these are all reputable, classically trained, fully qualified, properly educated physicians and researchers. My father wondered about my career choice some years ago, and he wondered why I was getting all this vitamin stuff. And I said to him, well, you know, there's quite a few medical doctors that have been writing on this and using it in their practice for a long time. And I showed him some of the papers, and he looked at them with great interest. And he said, well, if these doctors are doing it, there must be something to it. That was one of the nicest things he could have said to me when I was first starting out. If all these doctors do it, there must be something to it. The very first course I ever taught was in 1976, and it was called Forgotten Research in Medicine. And in so many ways, the course I'm now doing with you is very, very similar to what I was doing right from the start. And why is that? Because this is so, so important. Medical school is medical school. Doctors are not getting adequate nutrition training. It's also true for nurses. It's true for physician's assistants. It's true across the board, whether you're a dentist or an ophthalmologist or an optometrist. Even chiropractors, although they get more nutrition education than medical doctors, they're not getting that much. When I taught clinical nutrition at a chiropractic college, we had actually 2 courses in nutrition that the students had to take. I taught one, and then there was another one. At medical schools, 1 nutrition course is more common. Indeed, there are many doctors practicing today that have never had a course in nutrition. And even those that have had nutrition training said that it was very, very sketchy, and it was all about the food groups and classical, traditional, just eat a balanced diet nutrition. I think it's interesting that one medical doctor after another is out there curing patients with nutrition, and on TV or on the internet or in magazine articles, you still get the general impression that vitamins are an unproven therapy. That's nonsense. Remember, we are looking at the history of all this to show you solid proof from totally reliable sources that vitamins are in fact a proven and effective therapy. And from episode 2 on, we will show you how you can use vitamins in all kinds of health situations. But it's important that we set up the foundation first, that there is a documented history of this stuff actually working. So stay with us. Consider Doctors Evan Shute and Wilfred Shute, both medical doctors practicing in London, Ontario, not far from Toronto. They were obstetricians, and they became cardiologists because they discovered vitamin E. They treated over 30,000 patients with high doses of vitamin E, which they found to be amazingly versatile. Now here's an example of how far back this goes and how well tested it actually is. In 1936, the Shute brothers demonstrated that vitamin E-rich wheat germ oil relieves angina. Now angina is that pain down the arm, down the left arm, on exertion. My father had it. He was on medication. He didn't like it. He went to a specialist. He wasn't happy with how he was doing, and he asked me, not too long after we had our talk about there must be something to this, he said, Andrew, you got any vitamins for this angina? And I said, well, the Shute brothers used vitamin E for angina. You might want to try that. He said, well, how much of this stuff do I have to take? Everybody asked that question. And I said, well, it'll vary. You know, it's going to be hundreds of units. Most diets only contain about 8 to 12 units of it. So you certainly need a supplement. Yeah, well, how much? He said. I said, well, you could start with 200 a day and increase that gradually and see how much it takes to relieve the symptoms. So that's what he did. He increased 200, 400, 600, 800, didn't really notice much improvement. But when he finally got up to 1,600 units of vitamin E a day, he had no angina symptoms anymore. He was off his medication, that was it, and he never had medication again for the rest of his life. So he maintained his vitamin E level and did exactly what the Shutes would have told him. I just told him because the Shutes weren't there, and he followed their protocol and cured his angina. And the Shutes discovered this in 1936. In 1940, they showed that vitamin E prevents fibroids and endometriosis. There's a couple of problems that women are constantly talking about. Very, very common problem. And yet, since 1940, we knew that vitamin E could prevent those conditions. They're not easy to cure, but can we prevent them? Yeah, we can. By 1940, the Shute brothers showed that atherosclerosis, the underlying cause of most heart disease, is cured with vitamin E. 1945, hemorrhages in the skin and mucous membranes are helped by taking more vitamin E. And vitamin E reduces in diabetics' need for insulin. Vitamin E was shown to regulate heartbeat, sort of like digitalis, in 1946. And it was effective in cases of intermittent claudication. To this day, intermittent claudication, which is a cramping pain in the calves upon walking, is described as treatable with vitamin E. Now, what's curious about this is that doctors and nurses will acknowledge that vitamin E is good for the blood vessels between your ankle and your knee, but they miss the point that it's good for the other blood vessels as well, all through your body. The shoots were curing nephritis, thrombosis, cirrhosis, and phlebitis, all with vitamin E in 1946. 1947, they developed it further, and they showed that it was good, among other things, for reversing gangrene. They had a patient, a woman who I think was diabetic, and she was scheduled for an amputation of her leg below the knee. She had gangrene, blood poisoning. This is actual tissue necrosis, tissue death, and she was going to be told that was going to have an amputation. Somehow they got on there first, and they figured, well, let's try some vitamin E while you're waiting for the surgery. She started taking high doses of vitamin E, and it improved and restored the circulation in her lower leg and foot, and she ended up only having one toe removed. Now, there is an enormous difference between losing a toe and losing a limb. And this is how good vitamin E is for actually reversing gangrene, an astonishing thing to know. And this is just the beginning of it, because as the years went by, the Shoots had so many cures, they published in 1954 a textbook on vitamin E and cardiovascular disease. And after that, they published in other journals until the journals would not take their work anymore. The more they recommended high doses of E for more and more conditions, the more skepticism came from the medical profession, who criticized them without simply trying what they did and seeing for themselves. It would not be until the 90s that vitamin E was actually linked with cardiovascular disease at all, and there were a couple of famous studies published in the New England Journal of Medicine in 1993 that showed that men and women, if they took more vitamin E and took it for a long time, they had less cardiovascular disease. And the more they took, the less cardiovascular disease they would get. The Shoots were right. Now, the key again is dose. If the RDA of vitamin C is under 100 milligrams, and Linus Pauling and others are recommending 4,000, 8,000, 20,000, more than that, to cure disease, clearly the RDA is not a therapeutic amount. And in fairness, the RDA was never meant to be a therapeutic amount. But now, unfortunately, we have what is called a tolerable upper level. And that level for vitamin C is 2,000 milligrams a day. The reason that level is picked is because somebody somewhere had some stomach distress at 2,000 milligrams. So they say, well, anything over that could cause some kind of symptom, so the tolerable level is 2,000. The problem with that is it's now being taken as an upper limit. Instead of an upper level describing when you might have a symptom, it's now taken as a ceiling, which it was never meant to be. So remember, if somebody tells you that you can't take more than 2,000 milligrams of C, that's just not true. And we can check with Linus Pauling and William J. McCormick and others who have actually done the work. With vitamin E, we have an RDA of around 10 to 15 units of vitamin E a day, and the Shoots were using 1,000, 2,000 units of vitamin E a day. You see the difference? The key here is the dose. Another example would be the B-complex vitamins. And that brings us to the wonderful work of Ruth Flynn Harrell, one of my favorite people. Born 1900, she was at Columbia University and then Old Dominion University in Virginia. And she found major, measurable IQ improvement in Down syndrome children that were given very high doses of the B, as in Bob, complex vitamins. Now, how high is a high dose? Dr. Harrell and her team gave up to 100 or even 200 times the USRDA of some B vitamins to these kids. And the results were spectacular. There's a wonderful picture of Dr. Harrell being hugged by a Down child because the child could now read. The child saw its own improvement. One commentator said of Dr. Harrell, and quoted her as saying, that when these kids with severe learning disabilities, including Down syndrome, when they took the high doses of vitamins, when they had an initial improvement, the parents noticed it. And when they had increased improvement, the teachers noticed it. And when they kept taking the high dose of vitamins long enough, she said, the neighborhood noticed it. And I think that's particularly beautiful. So here's Dr. Ruth Harrell, who is advocating the use of high doses of the B vitamins, particularly thiamine, but actually all of them. And she was doing something that's generally regarded as medically impossible. Because Down syndrome is a genetic illness, it's assumed there's nothing you can do about it. But that's not true. We now have the science subspecialty of epigenetics, which is taking a look at what the DNA actually does. Your DNA is in your cell nucleus, and it stays there. But you have reactions going on in all parts of your cell, and you have 40 trillion cells in your body, more or less. So you not only have DNA, you also have what happens as a result of the DNA, and you can influence that with nutrition. Let's say there's a bridge out, and you're on your way to a different state, and there's a bridge out. Can you get off the superhighway and take a side road and cross by another bridge? Yes. You can still get there. Might take longer. Might be a little inconvenient. Might take a little more time, a little more gas, a little more patience. But you can do it. And when you use high doses of nutrients, it helps to overcome genetic deficiencies. The body can work around things biochemically. There's more than one way to skin a cat, is the old expression. But in the human body, there's more than one way to accomplish something, even if the DNA is off. With high-dose nutrition, Dr. Harrell proved that you can, in fact, still make these kids healthier and get higher IQ scores, measurable IQ scores, increasing 10, 15, or 20 points just by using vitamins. Now, in a Down syndrome kid with an IQ of, say, 50 or 60, possibly less, when they have an increase to where they're up to around 80, or perhaps almost 90, you have a child that is now very close to the normal range. And this is a fantastic improvement. You can't deny the results. And high doses of B-complex vitamins got them. So she was asked if she received any National Institutes of Health funding for her study, and Dr. Harrell replied, "Heavens no! Nobody knows anything about the area of dietary supplementation, but the National Institutes of Health knows for sure it's impossible." Now, I just love that, because here's Dr. Harrell, an experienced teacher and researcher, PhD, and she showed that children with Down syndrome had IQ increases, and she measured it. Then we have Dr. William Kaufman, not only an MD, but also a PhD, again, a real scientist who as early as 1939 was successfully treating both rheumatoid and osteoarthritis with niacinamide. He published a book on this in 1949. We have a tremendous opportunity here to treat what is a very common crippling disease in the elderly, and in the section of this course on elderly, we will be talking about Dr. William Kaufman. You'll enjoy that. We also have Dr. Robert Fulton Cathcart III, a medical doctor in California, USA, who used enormous high doses of vitamin C. We're going to talk about him in the special lesson on vitamin C. We have Dr. Ron Hunninghake at the Reardon Clinic, who uses intravenous vitamin C. He and his team have been doing this for decades. Dr. Honeyhacky told me he has supervised approximately 300,000 intravenous vitamin C treatments. This man knows what he's talking about. I say this often, but here it is again. My father told me when I was a boy, Andrew, if you really want to learn something, ask the organ grinder, not the monkey. So orthomolecular medicine is based on the clinical experience of physicians and patients. We are looking at what works, and the number one rule in medicine is to do what works. First, do no harm, and then do all you can do to the best of your ability for the good of the patient. This must include nutrition. I think someday, medical care without megavitamin therapy will be seen as we today would look at surgery without anesthetic. It's very important that this knowledge be available. That's why we're doing this course. I'm not making this stuff up. First of all, I'm not that smart. And secondly, I don't need to, because real doctors and researchers have shown us the way.
So vitamins are not just a good idea, they're absolutely essential. It would be great if pharmaceutical drugs did the job, but they don't. They're dangerous, they're expensive, and they don't work very well. Every year, pharmaceutical drugs kill 85,000 Americans, and this is if they are correctly prescribed and taken as directed. From normal side effects, 85,000 people a year, and that's the lowest estimate. Some estimates are almost twice that. And then we have other misuse and errors. The odds are that a patient in a hospital will suffer one medical error per day. Now, what can we do about that? What we need to do is use the available alternative, which is nutritional therapy. As Dr. Roger J. Williams said, himself a discoverer of one of the B vitamins, when in doubt, use nutrition first. This is the reason why you want to tune in for the next episode, because if you like this one, you're going to love the next one when we get down to the nuts and bolts, exactly how these doctors did it, the doses they used, and the individual diseases. So stay with us. Episode 2 is coming up.